Hello, everyone. Welcome back to another Monday training. This is Rob Van Bergen from Pain Free for Life. Today I was sort of thinking, what is it that I can talk about today? Sometimes I got to put some serious thought into this and try and really think of a topic that's going to, strike well with everyone. And as I was doing this, I was doing little wings. So I was doing one of these treatments on myself. I try and do it every morning because I find that it kind of gives me an energy boost, kind of wakens me up a little bit. And as I was doing that, I thought, well, these are the sorts of treatments that I do on a daily basis or, every couple of days that I'm like, well, people probably need to know this. So today we're going to be talking about the top 5 treatments and tricks that I think everyone should know. So whether you're a veteran microcurrent user, maybe you already know these things, maybe you have your own tips or tricks, you can share them in the comments below. If not, if you're new or if you're veteran and these are not things you've heard of before, then I really do hope you find them enjoyable. So 2 treatments that I think everyone needs to master are going to be our first 2, okay? Everyone needs to master these, and they may take a little bit of time to master. Some of you may get it on the first go. But the first one is vagus nerve stimulation. Now, I tried to show this last week in the live video and it crashed on me. So let's hope it doesn't do the same thing again. Vagus nerve stimulation is part of so many of our protocols. And the reason is that if we have one treatment that can bring you from a place of anxiety and stress and non-healing into a place of relaxation and calm and healing, then it's vagus nerve stimulation. So what you're going to need to do is you're going to need to set your device. Well, first, unfortunately, for vagus nerve stimulation, you either need an Evolution or a Pro Sport. You need a specific frequency. Trying to do vagus nerve stimulation with a higher frequency than this is not a good idea, not for any extended amount of time, okay? So what you want to do is you want to locate your pulse in your neck. So this is going to be different for everyone because we have different shaped necks, but you're looking for the carotid artery. So you feel around and you find the pulse. So mine's right around here. And then I just crawl back one little bit. So what I would usually do is go back an electrode length, but because I'm marking it for you guys, I'm going to feel where it is here. I'm going to crawl back. I'm going to go right around there with my electrode, okay? So I'm going to take my Y electrode, I'm going to put it right around there, and I'm going to kind of push gently and pull forward a bit. Now I'm on 7 to 12 hertz or FM 712A. And I'm going to start increasing the power until I can feel it. Now, what I should be feeling is a kind of little fluttering on my neck, and that's way too strong, so I'm going to lower it down. Okay, so you want a gentle fluttering, and you want to hold it in place for just a simple 3 minutes, okay? That is one session of vagus nerve, and it is almost always on the left side of your body. So doing the right side vagus nerve treats like your lungs and your heart. So it's good for respiratory issues, but it's not really going to resolve, chronic pain in the same way because the left side treats the gut, and we talked about this recently, the gut and everything else has to do a lot with inflammation. So you need to treat that. One area here is treating your gut and all of your body here as well as your brain. So that's simple, right? 3 minutes of that. That's the first thing I think that people should master. You should practice finding your vagus nerve and practice treating your vagus nerve. If you do that, you're setting yourself up for success because almost any treatment for any inflammatory disease or type of pain is going to need vagus nerve stimulation to resolve it. Done. Treatment number 2, little wings. Now, you either love or you hate little wings, but it doesn't change the fact that little wings is a very, very useful treatment to learn. Now, part of the reason for this is that so many issues to do with tension in your shoulders, your alignment, headaches, sleepiness, you name it. If you find you wake up in the morning and you get numb fingers, little wings, right? Like all of these things, anything muscular, we can really work on by lifting the shoulders and releasing them. And this is going to give you a good stretch. Now, little wings is one of those ones that people do find challenging. So I wanted to show this one as well. But I do think everyone should try and master little wings because at some point you're going to need it. Even, you know, you have glaucoma or you have some sort of eye issue, little wings. So let's work on mastering this one here. So first, you're going to need a mode that modulates. My preference is just go to 121 hertz in either the Evolution or the Genesis or Acute 3-to-1 in the Pro Sport because it's all ready for you to go. There is another option as well, which we get into in the training, but it's just for me, why create extra steps? So here, what I like to do is put the electrode behind my ear. So you can see where it's sort of sitting behind my ear here. Then what I do is I just drag it straight down into my neck where my neck meets my torso and I push. Okay, I want both of the balls to be creating pressure in there. Okay, now comes the fun part. So I'm going to crank up the power. Okay, so you can see my shoulder is lifting up and dropping. Now that's not me doing it. That's the device pulling it up and then dropping it. If you find that you're not getting a lift, try pushing the power further and further up, okay? Because sometimes what you do is you need to create more power in there so that the electricity can pull as it pulses. As it's modulating, you need it to be able to lift you up, and it's not going to do that if it's too weak. So pull, lift, drop, pull, lift, drop. That's what you're doing here. 5 flaps, as we call it, which is, you know, you're flapping your wings. You need to do it on both sides, and I'm going to do that on both sides because otherwise you end up putting yourself out of alignment. Oof. And what you'll often find that it cracks. It might crack your neck a little bit. It might pull your muscles really tightly. But if it's doing that, you need it. Anyone that's experiencing a lot of tension definitely can use little wings. Now, and I'm going to show you one more thing that you shouldn't do, which is a very common mistake. So you can think this is working out great for you and that you're doing it right. But if you're too far back here, you end up pulling your neck backwards, you see? And your shoulder might still go up, but your neck's pulling backwards. In that case, you're too far back. Move forward a little bit. Again, little wings. Master little wings if you can. If you can master that now, it's going to really pay off in the future because at some point in time, we're going to say to you, have you tried little wings? And if you don't know, or you're too frightened of it, or you haven't given it a chance, you know, yes, it's a protocol that causes you to lose control. It is going to move your body for you, but it is so powerful that we recommend it for so many different things. So we highly recommend you master that. Another treatment that I would recommend before I get onto my 2 kind of like tips of things that you may not know about is mitochondrial recharge. So we do talk about this in the manuals for the Evolution and the Genesis. And if you are working with one of our treatment coordinators, I can almost guarantee you've been told to do mitochondrial recharge. Mitochondrial recharge involves attaching pads or gloves and socks to your hands and feet and using blue stimulation. And what it actually does is it brings your energy levels up in your body. So it gives your cells the energy they need, improved ATP production so that they can keep replicating, which is going to be essential for the healing process. It'll also boost your energy. So if you're finding that you have a lot of fatigue, mitochondrial recharge is good to do. It's easy. I don't have gloves or socks with me here in this office, but what I would do is I recommend the gloves and socks because then you're not having to deal with sticky things on your feet and hands, and you've got them forever. You wear them, you run blue stimulation for 30 minutes, treating both hands and both feet. There is a mitochondrial recharge bundle you can get on the Santa shop where you can get a discount on the socks, the gloves, and the wire required together, and then you have it all in one place. I recommend that you know what you're doing for that one because any sort of healing process is going to be accelerated by knowing how to do mitochondrial recharge. So those are my 3 treatments. And so the 2 tips, I suppose. First one is to recognize the power of modulation. And I don't mean modulate in the pro sport necessarily. I mean when we've got the on and off like we do for little wings. Many people think that what they should do is they should go with, say, in the evolution, a straight 350 for dealing with pain and just paint over the area. And you absolutely should be doing that to deal with active zones. Active zones, for those of you who don't know, are areas where as you're dragging the device across the body, the device will stick. And this is actually just, your cellulose resistance to electricity. And so what it's doing is it's gripping the electricity. So it slows down. That indicates an active zone. If you move in different directions, you break up the active zone and you free communication to the area. That's great. But if there's no active zone and the area still hurts, what you need to do is you need to utilize a mode that has modulation. So what I like to do is I would just take the device directly. Say my, it's a good spot. Say my arm is really hurting right here. I would go to 121 hertz after I've painted out my active zones, slap the device right on there and increase the power. Okay, so as the power goes on here, I'll start to feel a tingling. And what this is going to do is it's going to go 3 seconds on, 1 second off. Now, Dr. Hashay has described this in the best way. I love this description, right? So why is this better for getting to this point of pain that won't go away than me just doing this over and over and over again? Well, that is useful to get rid of the active zones. But if I'm just holding a straight frequency on here, it's just consistently pushing. So if you imagine you've got a nail and you've got a hammer, and for this hammer, you decide that you're going to get this nail into the wall by just pushing, right? Is that effective? This is your straight frequency. Now, changes, doesn't it? If you go 1, 2, 3, 1, 2, 3, right? You're then hammering it in. So when it comes to modulated frequencies like that, you are pushing the nail in deeper because you're actually hitting it like a nail. So you're pushing the frequency in deeper and deeper and deeper till it hits that point. Now, when you're doing a straight frequency, you're not getting that same effect. So if you learn to start using modulated frequencies for specific points of pain that won't go away, you will find that you're getting some absolutely amazing advantages just for doing that. And my fifth and final tip of something you should master early on is dosing and zeroing. We don't dose and zero all the time, but truth is we could. Dosing and zeroing is this technology's, this specific microcurrent technology's ability to ask your brain to work on the body. So if you imagine you've got a broken, say you've had a knee replacement and your knee replacement is not healing. Well, often the body can absolutely forget what it's supposed to do. It is working on this damaged area because knee replacements, right? Like it's rough. If you ever seen one actually done, it's not a gentle experience. So there's a lot of trauma to that area. So the body is dealing with like a fallout from some sort of catastrophic nuclear event in the body, and it doesn't know what to do. It's just looking and thinking, how am I supposed to fix this? Dosing and zeroing can give it the information it needs. So you can dose and zero the opposite knee, and then you're giving it a blueprint. You're zapping a knee to your mind. And then the brain says, that's what a knee is supposed to look like. And so then when you treat the other knee, it has that same information to work on. Also, if you have a chronic issue that is just not going away, a dose and a zero could reduce your pain points significantly because, again, your brain is the one that's turned that pain on. So we're saying, hey, brain, look at this area. And it looks at that area and it says, oh, yeah, okay. I guess I left that on, right? So when my wife tells me that I leave the lights on all the time, right? If she brings me physically into the room and says, Rob, you left your office light on again. Well, I'm going to have to turn it off. It's been shown to me that I did it versus me just saying, no, I didn't. I'm sure I didn't, right? If I've been shown it, I can do something about it. If not, I may decide to live in ignorance that I didn't leave my light on. And though that may be a really weak analogy, what you're doing with the body there is you're asking the body and the brain to actually get in there and fix things up. So quick recap, top 5 things you should learn. First, vagus nerve, master vagus nerve stimulation. Okay. It's going to be so important to your treatments. Little wings. If you can get on top of Little Wings now, it'll be great, because not only will it make you feel better and looser, but it will be used down the line at some point for something else. Mitochondrial recharge. Learn how to give yourself the cellular energy you need in order to recover from whatever it is that ails you, whether it's post-surgery, illness, disease, however it may be. If you don't have enough cellular energy to replicate, you can't heal. Number 4, recognize the power of modulation. Use a hammer and a nail. Don't use your palm and a nail, okay? If you need to get rid of a chronic point of pain, hit it hard with modulation and notice the difference. Dose, and you know, as for time for that one, let's just recap that one really quickly. I would only do 1 to 2 minutes. Usually I only do 1 minute, 60 seconds, holding it on that spot. And then I want to check if there's a difference. Usually there is. And lastly, dosing and zeroing. I don't want to get, I could do a whole 30-minute lecture on dosing and zeroing, so I don't want to get into it here, but read your manuals, learn about dosing and zeroing. It's only like 1 or 2 pages. Figure out how to do it, practice on yourself, get familiar with it, because then when you need to do it down the line, you will have that tool in your arsenal. Okay, everyone, thank you so very much for joining me. I really appreciated it, and I hope this topic was helpful to many of you. If any of you in your years of experience with this technology have any tips or tricks that you would like to share with everyone in this group, drop them in the comments below. If you have any questions to me or need any clarification on anything, again, drop it in the comments below. I will get back to you. Otherwise, I hope you all have an amazing week. And remember, we are here to support you. If you need anything, just let us know. Thanks, everyone. Take care.